at our Rett Center, we follow and treat people with not only Rett syndrome, but kind of what we call Rett-related disorders. So Rett syndrome is caused by a loss of function of this MECP2 gene, but you can have a duplication of the genetic locus, and that causes what's called MECP2 duplication syndrome. And that's also a severe neurodevelopmental disorder that usually affects boys, but you can have girls and boys. And they have a whole host of problems and very severe seizures, and they are very impaired in their ability. They can't speak, and they have some hand function dysfunction too. And then there are other disorders that are called CDKL5 deficiency disorder and FOXG1 disorder, both of which have been initially termed as atypical forms of Rett syndrome, but now we recognize that they're distinct disorders that have some clinical overlap with Rett syndrome, that how they got lumped together, but they have their own unique set of progression and problems and prognosis. So, but we see people like that too. And then here beyond the group that I directly work with, but there are people who do work on Angelman syndrome and Prader-Willi syndrome and Down syndrome, and really then tailing off into kind of the very rare genetic things where they've just identified in the genetics clinic, they do undiagnosed disease clinic, and so they're pulling up singletons that other people have reported somewhere else, right? But you only have one or two around, or three or four in the country, right?